Number 1, thou shalt not eat without feeling guilty. Number 2, thou shalt not eat fattening food without punishing oneself afterwards. Number 3, thou shalt count calories and restrict intake accordingly. These are some of the 10 commandments on a pro-anorexia website found just 2 clicks from a Google search. It's not hard to see that such digital promotion of anorexic behavior can be deeply dangerous. Anorexia has the highest mortality rate of all mental health conditions, as I know from my own experience. Sorry. When I was 14 years old, I very nearly died from this dreadful disease. After an emergency admission to General Hospital, many months in an inpatient unit, and years in community care, I journeyed through to recovery. But sadly, too many of those I met along the way did not. Too often on social media, anorexia is glamorized. It's as if it's something to be welcomed and celebrated. It isn't. When I was discharged from the long-stay inpatient unit, I received a leaving book in which other patients had written personal messages. And I treasure it to this day, but I'm also desperately sad when I look at it. And I think about what happened to those other patients. When people are tempted to think that anorexia is not really dangerous, I'd say look in the leaving books of anyone who has been through it. See the lives that were ruined and the lives that were lost. Thankfully, through the wonderful support of my family and my church, I journeyed through recovery. And I continued my education, I went to medical school, and I qualified as a doctor. So I tell my story in the book Life Hurts, in which I reflect on it from the perspective of current medical knowledge. Alongside my clinical work, I'm also the medical director of Family Mental Wealth, a social enterprise which helps families to invest in their mental health and well-being. We're also developing resources to help families address a wide range of mental health issues. So, according to research by Ipsos Mori, published in 2018, public concern about mental health has doubled over the previous year, with 32% now calling it the most important public health issue. It's particularly troubling for the 8 million UK families with dependent children, especially when they hear that 10% of children aged between 5 and 16 have a clinically diagnosable mental illness. And one of the big concerns that families have is how the use of social media might be driving the growth of mental ill health amongst young people. This concern was particularly raised by the media coverage of the report from the Office of National Statistics in 2015, which said that there was a clear association between time spent on social media and mental health problems. At a very personal, practical level, families seek simple answers. They want to know what they should do to protect their children from potential harm in the digital world. But there are no simple answers. The relationship between mental health and social media is not simple. There's a great deal of complexity to navigate. The processes by which mental illnesses develop are complex and multifactorial. There are many different risk factors that may predispose different people in different ways, and then there are many different stressors which might act on those risk factors to precipitate and to perpetuate a mental illness, and many different comorbidities that may develop alongside. So there's no simple one-size-fits-all solution. No simple change we can all make in our family use of social media, nor simple change that social media providers can make that will suddenly lead to wonderful mental health for all. So, for example, I welcome the recent announcement that Instagram are taking down images that glorify self-harm. But let's kid ourselves that this simple action will solve the complex underlying issues that lead to such distress in people that they feel compelled to harm themselves in such ways. If you want to get an overview of the latest evidence on the relationship between social media and mental health in young people, I would recommend these two papers. They provide up-to-date information on the digital lives of children and young people in the UK, and they address some of the complexities. So, for example, looking back at the Office for National Statistics statement that there is a correlation between time spent on social media and mental illness, the fact is that correlation doesn't always mean causation. It doesn't necessarily follow that reducing time on social media will improve mental health. When considering the complex processes of mental health within complex human beings, we need to apply a multivariate analysis, not just looking at a single variable of time spent, but also considering other variables in that young person's life and digital experience, such as whether they're experiencing cyberbullying. When we do such a multivariate analysis, we find that for those who are experiencing bullying online, the impact on their mental health is very large. But for those who are not experiencing bullying, the relationship between time spent on social media and mental ill health is actually relatively small. Therefore, the issue is not how long someone is spending on social media, but what is happening to them through that medium, particularly whether they're experiencing cyberbullying. And this can be particularly distressing for 3 reasons. Because it's not limited to physical presence, because a single incident can be shared and forwarded to multiple other people, and because the anonymity allows for greater cruelty compared to face-to-face bullying. So this more sort of careful, detailed look at the evidence will enable us to focus on specific issues that can be addressed, rather than falling for a knee-jerk blanket reaction against social media. Added to this, there's the fact that social media can actually be a very positive force for good. And these 2 reports highlight this. It can build social connections, enabling people to make friends, engage in community activities, learn new skills, and develop new hobbies. And far from being an inevitable source of harm to our mental health, the digital world can be a positive source of help to build our mental health and well-being. And so that's why the government has recently invested $35 million in the Digital Health Technology Catalyst Fund. This is funding 139 projects led by small businesses, NHS organisations and universities, all pioneering digital health innovations. Most of these funded projects address physical health, such as using digital technology to identify early-stage cancer, but there's some investment in using digital health for mental health. And that is one of our projects at Family Mental Wealth, with our collaborating partners, King's College. Together, we're developing Headway, an app to facilitate family-based, proactive self-care. Our vision is to use digital technology specifically for the good of people's mental health and well-being. Family Mental Wealth is not a faith-based organisation, but myself and the other 2 founders are Christians. And for us, building a positive digital resource for mental health is part of our calling to be co-workers in God's redemptive mission. Clearly, social media can be used for harm. But the challenge for us all as Christians is to consider what we each can do in the digital world to play our part in God's redemptive mission. Thank you.